Today's episode is a really exciting one. Not only are we welcoming back the founders of Dimer Health to the podcast, but we are also catching them at a huge moment in their journey following the announcement of their recent Series A round of funding. Healthcare's modernised what happens inside the hospital, but as Dimer Health points out, the 30 days after discharge remain one of the most broken and overlooked parts of the patient journey. Today, we're going to dive into how Dimer's using clinician-led AI to rethink post-discharge care, reduce avoidable readmissions, and build what could become an entirely new layer of healthcare infrastructure. Carrie, Riggy, David, welcome to the show. Excited to get stuck in. Well, it does make me very happy to welcome a previous guest back on, especially one as successful as Carrie and the team. I had Carrie on back in, I think, October, November last year, and they kind of told me there was some news coming around, and they've just recently announced a Series A. And also, for the first time ever, actually, we've invited two of our very esteemed colleagues, one being Riggy, who's also a co-founder, and also the Chief Medical Officer, Dr. David Feldman. So, as mentioned, a load's happened since we spoke, but for those that may have missed the last episode, who are Dimer and what problem are you and the team solving, Carrie?
First of all, thanks for having us back on. And I really enjoyed the conversation and excited to share all of our updates with you.
Pleasure.
So, yeah, Dimer Health, we're fixing the discharge problem that exists. So we're taking the time after someone's discharged from a medical facility until we can get them connected back to care, and fixing that with our technology and our transitionist clinical team. So we have a medical practice as well.
Fantastic. And Riggy, question to you, because obviously I've not met you previously. How's that journey been for you both, obviously as individuals, but also as kind of co-founders?
Yeah, so I come from a background of technology and products and building products and companies. Been doing this for many years. And actually, I met Carrie through a lifelong friend, Gidon, our third co-founder. Gidon and myself, we grew up together. Gidon turned to the medical side, and he met Carrie. And Dimer Health was started with the vision that Carrie laid. And, we're working very closely together to see how tech, AI today, and great clinical care can help our patients.
Amazing. And for question for you, David, in terms of kind of the medical problem and the medical issue you guys are solving, because obviously if people look at your website, that front and center, there's a video you can press, you can look at ultimately, the why here. But what bigger problem are ultimately you trying to solve here?
It's a good question. It's an overarching sort of mission of what Dimer is, and sort of our North Star is, at the end of the day, just doing better for patients. Healthcare is fragmented. Patients get information and it's not fully explained to them, or they're unable to ingest it for a variety of reasons. And so the real medical clinical component to this is they've had an acute event in their medical journey, whatever part of that medical journey there is, and they need their hand to be held to make sure they fully understand it. And how does it fit in with their larger medical journey? And so it's just a matter of continuing that care with patients and making sure that they do better once they're home and prevent them from having to leave their home.
And what's the current setup? So say before Dimer, in terms of obviously you being, how would they typically be cared for post-acute care or post any kind of hospital visit? What, and I know that's obviously the problem you're solving, but what would normally happen or currently be happening?
So, patients are discharged home and you're sort of discharged with this stack of papers. And I'm saying a discharge from a hospital if you're in an ER, you were admitted and you're going home, or after a surgery. And you have sort of this stack of papers, and the stack of papers lists out what happened to you, what your potential next steps are, and who you're supposed to follow up with. And it's a static event. Patients then go home, and it's up to them to figure out what the next steps are. Maybe they'll get a call from a nurse. Maybe they get a follow-up from some part of that health system, but nobody that is invested in making sure that the next steps are really followed through for the patient, and that when the patient goes home, and it's a very vulnerable period, that somebody is there really at any time, day or night, to answer a question and to really delve in deep into what just happened to them and what the next steps are. And if there are any clinical concerns in the moment, we're going to take care of it right then and there.
Yeah, it's fascinating, isn't it? You look at different demographics of population and people who, maybe aging, patients who, let's be honest, you leave a hospital. My wife recently had a small procedure and you come back with about 50 pages and you think, oh, I've got to read through this now. And it never happens ultimately, or it does eventually, but it's ultimately you're trying to be that kind of within 24 hours, isn't it? I think some of your operational setup. So within 24
Yeah.
hours and continually that.
And another component to it is the existing model, it puts all the onus on the patient.
Exactly.
And in our model, we're very much trying to be proactive. The
Mm,
patient is discharged, we receive a referral, we reach out to them.
yeah.
We are very deliberate about that to make sure that we almost help form a bubble around the patient, bring them into us, make sure they get their care.
Yeah, I love that. And a question for you, Riggy and Caroline, in terms of people always look at fundraising and they think, right, problem solved. They've got capital now. That's it. They're off to the races. But, that for a lot of startups is typically when some of the problems, start to happen in terms of operational priorities, bad hires, changing business objectives. But for you over the next 6 to 12 months, what are your kind of key priorities?
That was a very good question. So we, for sure, this up until the Series A, it was about really demonstrating that, and is there early indications that this is something that we can really take and scale. And then we raised on that, and now we have to take all of the great work that's been done so far, continue to keep pace with the ever-changing technology that's happening, and take this to scale. And I think one thing
Mm,
that we're solving this time in between the discharge and the follow-up, and it's a part of the patient journey that hasn't changed in decades. So like we're still doing the
mm.
discharge process the same way. It's like playing video games on the Atari versus whatever PS version is out there now. And we can really leverage this time and take this whole idea of what does it mean to be discharged and what is that process and turn it into a whole different experience. So I think the really cool thing now is that
Mm,
we are going to take what we've learned, scale it, and take this process and turn it into a dynamic, proactive, patient-centric that's going to continue to deliver the outcomes that we've seen up till now. And to me, that's really exciting.
mm,
It's also really hard and scary. And I think that for me, personally, the challenge is as the needs of the company change, how we lead the company has to change, but the core of what's in the heart of the company
mm.
cannot. So that to me has been my challenge.
Yeah, no, that makes sense. For you, Riggy, is that kind of similar in line for you? Because I'm guessing as co-founders, the question I'll probably got for you, Riggy, is how do you decide who prioritizes what initiatives? And because a lot of co-founders they have their lanes, right? You've got the more technically minded co-founder, and they just focus on all the technology initiatives, and you've got the more operationally strategic person. But how do you split your time, Riggy, in terms of knowing what initiatives you need to focus on versus Carrie's, for example?
Yeah, so I think first of all, as Carrie said, pre-round A it was all about product market fit, and we've proved that. And post A it's all about scale, and I don't think it gets any easier. I think if anything, it gets harder, right? Because you do need to scale this, 10x and then 20x. It's like that. That's our goal in terms of the responsibilities and how this whole thing works together. So I think it starts from the company strategy. Is the right way for us to scale in terms of the business, in terms of the technology, the patient experience. How do we maintain clinical quality as we scale, right? I think there are a few things that we've done well. For example, patient satisfaction is through the roof. Clinical outcomes are great. So we need to make sure that it stays like this and even gets better to keep on pushing ourselves and the team. So I think it all starts from agreeing on what is the strategy to scale the company, and it has implications all over, like business, go-to-market, product technology, again, patients. Once we agree on that, and I think we are in agreement, then it's creating a roadmap. So we have 3 to 6 months product technology roadmap, clinical outcomes, operation, everything is planned and subject to changes, to quick changes. I think this is something that's very critical to any startup, and measuring everything, the impact. We're data driven to make sure that we set goals and we constantly monitor our progress and whether we are meeting those KPIs and goals. That's how we do it.
Yeah, and he touched on something really interesting. I think getting that product market fit is probably the most important thing, right? Especially in this world of AI and tech. Is, a lot of companies are still trying to work out that PMF on the fly, and I think that causes problems when it comes to hiring and what do we go, how we, what's the path we're following, and on the people piece, because I know that a lot of investment typically does tie into scale. You've got to hire, you've got to bring the right people in, but how are you going to ensure that the people you hire are right for you, and are in that kind of up for the challenge, and all the kind of cliches around working in a startup, but and also more importantly, how are you going to ensure that the culture still remains core to what you built? Because I think that's the big issue, right? When you grow, you're being taken left, right, and center, and ultimately you're hoping that second layer of management are kind of immersing everyone into the culture. See, I suppose question for you first, David, in terms of for the more medical side of things, how are you going to ensure that the folk you're bringing in are really kind of ticking the box on that front?
It's a good question, and it's certainly part of the challenge. Carrie, Rigi, and Gidon have done an amazing job of building a culture, and we've followed that culture. And the other medical director and our clinical leads, I think, have done a good job of now sort of transcending that culture down to our frontline providers. And it's very important that one, they understand that culture, and that two, they're able to perform the work that we need them to perform at a high level. Emergency room providers have a unique ability to sort of deal with whatever comes through the door. And it tends to seek its own level. And we've had a lot of great experience with working with emergency room providers because they can sort of fit those needs. They're used to sipping water through a fire hose, if you can see that analogy. And that's part of being in a startup, both on the tech, on the product, on the operations, and on the clinical side of it. So we've just done our due diligence on who it is we're going to bring in with those factors in mind.
Yeah, it's a good point. On the kind of retrospective reflection where someone may not have worked out, have you kind of locked in the type of profile that would work well there? And kind of who is that person, Carrie, do you think?
Sorry, I laughed at that question because it's hard. Because we're in an ever evolving environment, and what worked on the first 6 months of the company might not work at year 6 of the company. And so I think just that in itself is someone that can understand the ever evolving demands of a company as it grows and changes, and can change with the company. And I think what we've seen challenges with folks is when the company's changing and it's hard for them to change. We try to get it right and try not to make the same, hiring any mistakes twice. And we actually, when we hire people, we have them interview, especially with the leadership, we have them interview with multiple leaders in the company. We heavily involve our HR, who's come up with a great process for that. So we don't want the people decisions are important. And I think also sharing the culture of the company and someone that aligns with the culture is also really important. You have to love people and you have to love patients and love figuring out how to do that better. So, yeah.
Yeah.
If I could just sort of follow up on that and sort of the question posed, it pains me because I wasn't a Patriots fan, but I am a Bill Belichick fan because he did coach for the Giants at one point. But he has an important statement of saying, just do your job. And if you do your job, the team will be successful. And I think and Carrie and Rigi, correct me if I'm wrong, as you start in the startup very, very early on, you need people that are multidimensional, that can fill in multiple roles and straddle different positions. And then as you grow, you almost need to move away from that a little bit and have hires that are just specific for the jobs that they need to do. And I think that's a lesson personally that I've learned greatly. Particularly when hiring clinically, you want to make sure that that's what their role is and they're going to do, not something else that they've done in the past that might be able to help you over here, if that makes sense.
Yeah, I think it's a really interesting point. I tackle this from a talent perspective for startups every day, and it's really interesting because you get to that tipping point. I do think actually it's seed to Series A, where there's pre-seed, seed. They're very close to the founders. They're literally covering everything. If they go to market, they're doing product marketing, they're doing content, they're doing social, they're doing everything. And then as you make that step towards Series A, you need that specialist talent to take you to that kind of next growth curve, but then do you hire someone that's already done it and they're going to take a step back? Do you hire someone that wants to step up into that role? What happens to the team that are already doing it without putting their nose out of joint? So yeah, it's super tricky. And I suppose for you then, Riggy, if you're looking at the current team that you have, how important is it that they're also bought into this kind of next stage of the journey? Because some people love early stage, but as soon as you start going to Series A, Series B, ultimately the company has to change. So what steps are you taking to ensure that everyone is kind of on that next journey?
I think it's a very interesting question and something that that's a focus area for us, and I'll explain. I think in tech, product and tech, the world is changing very quickly. And roles are changing now also very quickly. So we are now moving towards a place where, like it used to be that product, design, engineering, the boundaries were clear, and it's now changing, right? Because anyone can turn into a builder, and adaptability is critical, and being able to adjust as technology changes on how you build things. So I think one of the most important things right now for anyone, starting from your head of engineering to a developer, is being able to adapt quickly and use the latest and greatest in a responsible way at all times. Like we're now interviewing both candidates for head of engineering, actually, if you know someone, but also bringing in more developers and product people, and you can see people that ran like engineer organization of 100, 200 million north of that, are now going back to hands-on AI development, things that they haven't done for years, which I think is critical for now. And it wasn't the case like a year or 2 years ago, where people went back to hands-on and taking advantage of the things that are out there today and changing so quickly.
I think it's a super interesting point, actually, for listeners here as well. What we've seen from a hiring summary is the techies out there want to go back to what they loved first and foremost, and that is being hands-on. There's so many tools. Obviously, look at Claude Code. You've got all these new AI assistant tooling and dev tools out there that as soon as you get to that management layer, I think you do put yourself into a risky position where, you need to be hands-on. I do massively believe this. You need to love what you do, and you need to be using AI confidently, not to replace you, but ultimately just to free you up to do even more better, greater work. So yeah, I think it is really interesting. We've definitely seen that wholesale shift. FDEs, we're seeing AI product owners, we're seeing this. Everyone is making that shift now, thinking, I've got a team of 20 now. I just want to be hands-on. I want to go back to what I loved. So yeah, and I'm all for it. I just think there's going to be, I don't know if you believe in this, but I think there's going to be more startups hiring less folk as opposed to companies hiring more people. I just think it's going to be better quality people using better tooling.
Exactly. Yeah.
And
what we're doing.
Sorry, Alex. We're even looking at that on the clinic side. That where can we leverage all of the tools at our disposal to not only deliver great care to patients and help support our clinical teams there, but also help take off any of the work that can be done by not a human, so that the humans can do their most meaningful work.
Yeah, massive agree. And I also seen the levels of increase. So whereas you had those kind of say on the clinical, you got the data entry, what you're seeing is actually AI can take that, but it's basically just raise the level for where you'd be starting your job now. It's actually you're pushing on more quickly as opposed to being replaced. So I do massively believe that. And I think, I touched on it kind of earlier, but in terms of obviously post funding, you're obviously in a really good space. You found that product market fit really early, but obviously being honest with yourselves, what do you think over the next kind of 6-12 months looks like from a potential risk standpoint? Obviously there is so many companies pouring in with AI this, AI that, but what do you think from a challenge and risk standpoint is the one that stands out, do you think? Probably a question for you, Carrie.
Well, I have a few things that I think are some of the risks that we might have, and that are just industry trends that are occurring. And also I can share like a kind of an interesting patient story that I think may tie it all together, if that's good.
Yeah, nice.
I think just the speed of everything, like the the technology and the evolution of AI and AI being integrated into the healthcare system, I think is happening. There's change happening at a pace that healthcare hasn't ever seen before. I think at one
Yeah.
point, like there'd be a medical study that would come out that would show a better way to do things, but it took years to make change in healthcare in the past. And now change is happening every
Wow.
month. And so I think just the pace of change and keeping up with that, and in a culture that's not used to this pace of change, as a strategic, as we are deciding which strategic business moves we need to make, we want to make sure that we're delivering those, getting in front of the partners and the customers at the right time when they need the products that we're building and the services that we have, and doing it in a responsible way that ensures good patient care, and also that we're positioning ourselves for that continued change so that we're already above and ahead of the curve with that. And the example, and I think this ties also to your other question about culture, is, we're using technology and AI in how we're delivering services and identifying what patients need. And one of the things that we do, we have all company meeting every month. We call it our all team meeting. And we start that meeting with a patient case. And one of the things that's important to me, and I think to all of the leaders in the company, is that we're able to tie together the experience of every single one of our patients to the inputs that we are all bringing in our different roles. And so we've had a really interesting case a couple months ago where we have an AI. We have like an AI clinical teammate, we call her Amy, that knows the patient. So it's tied to the patient's medical record and the conversations that we've had with the patient, and can have conversations appropriately with the patient and then escalate to our clinical team that's needed. And we monitor all of those things real time. And so looking at how humans and AI interact is really interesting. And as technology and regulations evolve, the ratio of those interactions and the quality of those interactions, we're watching those very closely and preparing for that. But in this particular case, this was a patient that had a very unfortunate circumstance, and she ended up with a pretty serious trauma and surgery that she needed to have. She's a young woman with a baby at home, and went home after the hospital stay. And our clinical team met and discussed the case, and we had a visit with the patient, I think the same day or the very next day after she came home, and with a plan for her. We introduced her to Amy. And it was really interesting watching the conversations that she had, because when she reached out to us, it was 3:00 in the morning, and she had these long conversations with the AI. And one of them we actually had to escalate because there was a medical issue, and it escalated to our clinical team. We intervened and we were able to avoid an ER revisit for her. But just the fact that between our clinical team and the AI met this really complicated medical and social case, where the patient was at when she needed it the most. And her experience at the end was like this overwhelming gratitude for the experience, and being able to share that with the team. So like the product team, with all the work that they did tied into her care, and this like amazing experience with Amy and the clinical team, and how it all tied together to really deliver care to a person in the way that was the most meaningful to them, to get the outcome, was just like the most beautiful thing. And so all the challenges coming out, like if we can make sure that every patient is met where they're at with all of this, I can't imagine. We have to win this game.
Yeah, look, it's a fantastic case study, and it's also a kind of a tip of the hat for saying on that true North Star from when we spoke back in October last year, in terms of what you've been unequivocal in terms of what your focus has been, and ultimately it's to provide better post-patient care, right? And that's, and a question for you, David, then on the kind of more medical support side of things, what's your general consensus and feeling about patients interacting with an AI as maybe not a first port of call, but potentially as a port of call? Because there is that kind of, I've got aging mum, and she does everything she can not to speak to AI on anything, banking, anything. And if I said you've got to speak to an AI, she'd got absolutely no chance. She'd rather walk somewhere and talk to. But what are your thoughts about the kind of changing in consumer or patient habits right now? On Carrie's point, which potentially could lead to an intervention, potentially a life-saving solution. So what are your thoughts on that?
More and more people are interacting with AI, particularly for their medical care. So there are certainly cohorts of patients that we need to be aware of who might be high utilizers of AI, who might be minimal utilizers of AI, and how do we manage all of that? The high utilizers of AI They love the technology. They're typically very used to dealing with it and have great interactions with what we're building and what we're doing. Patients that might be a little more reticent to utilize AI and reticent to utilize technology. One, that hurdle is a lot less than we thought it was going to be.
So
Just overall, I think one of the benefits of COVID was people, even our geriatric population, over 65 population, getting used to utilizing technology to communicate with their family, with their friends, with their loved ones. And that has definitely spilled over into what we're doing now. We also have different modes of communication. If a patient doesn't want to utilize AI, we would certainly want them to because it's a great tool and they can. But if they don't want to, there's text, there's phone calls, there's other ways for them to interact with us in a meaningful way to help with their, care in real time, preventative care and whatnot. And also a tip of the hat to Rigi and the product team is they made it as easy as possible to utilize. So to your point of, maybe your mom that would rather not use it, once they see how easy it is, it becomes it becomes very adoptable.
yeah, I think you've also the adoption of why other tech is obviously we've seen that as well, like a WhatsApp and everything's more, if you take your phone, you can literally run your life from your cell, right? It's just like everything's there. And actually, I think maybe there's that shift is becoming a bit more upstream toward the aging population where it just becomes a bit more normalized. Maybe my mum's just the the exception to the rule here, but yeah, it's always interesting because when people say, they always obviously goes down to Riggy's point on the product side. If people feel comfortable enough going on that product journey and speaking to AI, then obviously you're doing something on that whole UX feel and everyone feels actually this is the right solution for you. And final question, I probably want to ask the same question to you all individually because I know you've all probably got your own idea of what success looks like. But for you, Riggy, from a product standpoint, over the next 12 months, what does success look like for you and your team?
Yeah. So, few focus areas for us. First, we have our own homegrown technology to scale the company, the back office, the back end of the company. So we are working more and more to automate and orchestrate all the things that need to be done, um, while maintaining the quality of service, clinical, and so one goal for us is to scale efficiently, right? To reduce more and more and automate more of the stuff that can be easily automated. And the second part is the patient-facing experience. So as Carrie said, we do have our own personalized AI chatbot already out there, and we're adding more and more features, turning it into a true personalized, continuous care experience that knows your medical history and provides help and guidance when needed throughout your care journey. By the way, I also wanted to say to your previous question, I think what's unique about us is that if you look at the patient's journey, they first get the help that they need from one of our human providers, and only then they can optionally talk to an AI chatbot, which is different from what
Interesting.
many others are doing. First of all, trust is established, right?
Yep. Yeah.
And second of all, then they can still choose to text, call, or book an appointment with a human provider whenever they want. And the AI chatbot also suggests that on his own, right? When that's needed. So we actually see a lot of the older population feeling comfortable with using our AI tech because I think of that trust and guidance. So we want to keep on and improving that tool, and there's a lot on our roadmap.
Yeah.
AI driven hybrid care.
Well, I think it's that human in the loop piece that for patient care is probably going to be so important, right? I think if they suddenly feel they're only going to speak to AI, I think they can cause more anxiety than, that needs to be presented. And for you, David, from a medical standpoint, from your team, what does success look like for you guys?
Yeah, so to sort of tie it together, we spoke about product market fit. And I think we've done a great job of showing objectively what we said we could do subjectively. Now, I think over the next 12 months, it's the goal is relatively simple. Just doing it better continuity of care, better outcomes with a simple delivery to our patients, a simple sort of user interface so that they want to use it, and how to then grow that at scale and provide this sort of relatively concierge service to the masses. And that's really what would define success over the next 12 months is to continue to do that better.
That's such a good platform to build from. Going back to kind of Carrie's case study, you know, I think that gives you your feather in the cap, doesn't it? When you get one of those reference points, think, oh, we're on the right path here. And last but not least, obviously, Carrie, for you, obviously, you know, obviously we've been fortunate enough to meet previously, but you know, based kind of where you were, seed fund to now, you know, what does the next 12 months look like for you?
So I think in addition to everything that David and Rigi said, which are spot on, like we want to continue to evolve the technology. I think one thing is bring the caregivers into the conversation too. That's one beautiful thing about virtual care. And like David said, continuing to maintain our outcomes and the patient experience. I think I have like this grand vision, and maybe that's why I'm in the role I'm in. I don't know. But I think we all share this, that we want to fundamentally change how this part of the care journey for people is experienced. And you don't have to always do things the way they've always been done, especially when they're not that good. And the way we've always done it just really isn't that good. And now we have all these new tools that can make the patient experience during this extremely vulnerable time so much better for the patient, better for the people that love them, and really respect them as individuals and the time that they have and that they're experiencing their recovery. And so I think for me, being able to take that vision of, you know, the discharge yesterday is not going to be the discharge of tomorrow, and being able to bring that into the ecosystem as just the expectation that we're changing this process, and that, you know, Daimer Health has unlocked how to do that well, and really being able to scale the company through that belief.
Absolutely. You know, I've got every confidence you guys will do that. And it's, it's been really good to have you on. And for people listening here, Rigi alluded to earlier, they are hiring, they are growing. Check them out when we go live. But Rigi, Carrie and David, thanks so much for coming on this afternoon. It's been, super interesting. It's, I'd say first time to get someone back, certainly post new fundraise, but it's really nice. And, the North Star's still the same, which is fantastic. Nothing's changed. You continue on the path you're on. So thanks again, guys.
Thank you, Alex.
Take care.